It's me, nurse practitioner, Dr. Katina Kennedy, here with some health information for you. I have received numerous inboxes. Please help me to control my chronic sinusitis. Sinusitis is inflammation of the sinuses. Your sinuses are here, okay? Your sinuses are here. And persons usually have symptoms of just a chronic headache. They feel tired all the time. They feel foggy. They can't concentrate. They wake up stuffy, congested. They also have like this postnasal drip to the back of their throat. So they always have a dry cough. So those are some symptoms of persons who do have chronic sinusitis, or those who have acute sinusitis as well. But I'm more so talking about those who have chronic sinusitis related to environmental allergies. So those are some of the symptoms of it. However, what can you do? Well, for those who have that chronic inflammation because of the environmental allergens, we recommend doing like the neti pot. Have you all heard of that? Research it, Google it. It's basically where you rinse your sinuses out using nasal saline, or you can use the neti pot. Actually goes deeper into the sinuses. Normal nasal saline goes into the nostrils and rinse out the nostrils, because remember, most viruses, most bacteria, they enter into the nasal cavity here, into the nostrils. So it's very important to keep that area clean. So pure nasal saline is really, really good. That'll help. So using the neti pot will help. Sometimes some persons have to use like a nasal steroid, like Flonase, Nasacort, Rhinocort, and that helps decrease the turbinates on the inside of our nostrils. So that'll help decrease the nasal turbinates and allow the sinuses to drain properly instead of just to the back of the throat. That's why you wonder sometimes at night when you lay down, you have this chronic cough. You cough, 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 cough. And then also when you wake up in the morning, you're congested with mucus. It's because everything settles to the back there. Also, some people also have to take like a Zyrtec, an antihistamine. So a Zyrtec, Claritin, or a Loratadine, which is generic for that, Allegra. So those are some antihistamines some persons have to take. They may also have to do Singular. They may have to take Singular, which is multi-class. That's the generic name. Because what happens is it's things in the environment that increases mucus within our ears, nose, and throat and sinuses. So if you can control or help block environmental allergens from increasing mucus, then you can decrease your reoccurrence of sinus infections. Because what happens is when the mucus builds up in the ears, nose, and throat and sinuses, bacteria or viruses begin to grow within it. And then that's how some persons are sick over and over again. You wonder why you have to keep going to your healthcare provider to get antibiotics, or you're sick all the time. So those are some of the things. Neti pot, nasal saline, the nasal steroid to help decrease the turbinates, and antihistamine, and lots of water, lots of fluids, because that helps break up the mucus as well. And then of course, use your air filter for your house, your environment that you live in. An air filter, your humidifier, all of that actually work. You just have to stay consistent with it. If you've tried all of that and none of it works, then you may have to see an allergist. And at that point, you may have to try some allergy shots and go from there. So those are some of the recommendations that I usually provide for my patients. Remember, the information that's provided in this video is not inclusive just to this information. If you have some recommendations, go ahead and put them in the comment section. Don't forget to follow me on YouTube in case you missed some of my videos. Nurse K. Kennedy. Until next time.